Good evening, everyone. My name is Am Johal. I work here at the SFU Woodward's Cultural Unit in the Vancity Office of Community Engagement. We're excited to be partnering this evening with Stop the Violence BC. I especially want to thank Michaela Montaner and Emily Ann Paul for the work they did in support of putting this evening together. And even a couple of nights ago, we had a nice evening with the Naomi Patients Association, and back in the spring, a talk on health harm reduction in the law on Insight, which was a full evening. And we hope at SFU Woodward's here that we're going to be able to be part of the nexus of the public sphere by bringing interesting conversations into the city. The event tonight will be webcasted, and there will be a copy of the proceedings up in a couple of weeks off of the sfuwoodwards.ca website. But to get on with the evening, I'll be introducing the moderator, who is Catherine Gretzinger. She's an adjunct professor at the UBC School of Journalism and is known for her radio work. Catherine has been working with the CBC since 1988 and has covered a wide range of stories, from the mysteries of Vancouver's underground tunnels to the exploding drug scene in the city's downtown east side. She's involved in community work focusing on social issues, including mental health, HIV/AIDS, and Native issues. I ask you to join me in welcoming Catherine Gretzinger.
Thank you very much, Am. Lights are bright tonight, so you'll excuse me as I adjust here for the moment. Welcome to Simon Fraser University. It's nice to be here on behalf of myself, not UBC and not CBC. I'm here as myself tonight. And I've been lucky. For 20 years, I worked as a journalist in this community, and I've had a front row seat covering the drug issue in Vancouver. It's given me the chance to learn about the consequences of the use of drugs, illegal and legal, the consequences on people's individual lives, on their neighborhoods, on our community, and on a system that is supposed to help and protect people. Way back then, a couple of decades ago, just a few people were talking about drugs, publicly anyway. The discussion involved a few concerned citizens, a few drug users, a few healthcare providers, and a few activists. All of them were trying to wrestle with this whole dilemma of illegal drugs. What do they mean? How are they used? What are the impacts that we should be thinking about? And then people started dying. First, dozens of people started dying, and then hundreds of people started dying, not just in this neighborhood, but across the province. In 1993, more than 300 individual lives were lost to drug overdose. And a few more people started asking questions about what is going on and why. And those questions led to an inquiry. BC's Chief Coroner Vince Kane wrote a thorough and compelling report. He argued that more had to be done immediately. The situation had to stop, that drug use ought to be treated as a health issue, not as a criminal one. Now, his report recommended 62 changes. You can speak to people in the know about this. Not a whole lot of them have been followed up on. But what that report really did was it started a real public dialogue. People started to openly ask questions about what was going on. It was no longer little groups of people here and there. It was an out conversation that we started to have. A few years after the Kane report, the Mayor of Vancouver, Philip Owen, with the guidance of Donald McPherson and a number of other people, took on drugs. It took them a while, but after loads of consultations and a ton of research, the 4 Pillars strategy was born. And today, believe it or not, this month, the 4 Pillars strategy is 10 years old in the city of Vancouver. And Insight, just down the block, Vancouver's supervised injection site, is one of the strategy's key successes. We've talked over the years about heroin, about methadone, cocaine, crack cocaine, crystal methamphetamine, Tolwyn, Ritalin, and on and on and on. And we've made a lot of jokes about BC Bud. But tonight, we're actually going to talk seriously about the consequences of Bud, BC or otherwise, of marijuana, weed, call it whatever you want, cannabis, the official name. You're going to hear tonight from people who are going to be making presentations that we hope will make you think twice about the impact of illegal cannabis on this community. We're going to hear from a researcher medical doctor, a human rights expert, and a law enforcement official. All of them have insights to share about what they see as the real impact of illegal cannabis on the community. And I'm going to begin tonight by introducing Dr. Evan Wood. Now, for anyone who has followed the drug issue in our community over the last decade or so, this man's name is very well known. Evan is the co-director of the Addiction and Urban Health Research Initiative at the BC Centre for Excellence in HIV and AIDS. He is also the founder of the International Centre for Science and Drug Policy. He is also an internal medicine physician specializing in inner city medicine. He's a clinical epidemiologist. He is internationally recognized as an expert in drug addiction and related drug policy. His clinical and his current research work focus on inner city medicine issues, including the treatment and prevention issues that we talk about so often in public. What's facing injection drug users? What kinds of public health initiatives could be used? What kinds of HIV prevention strategies work? He focuses specifically on street-involved youth as part of his work. Evan is a co-author of Stop the Violence, British Columbia's first report that's just been published, Breaking the Silence. It's called Cannabis Prohibition, Organized Crime, and Gang Violence in British Columbia. It's an honor to welcome Dr. Evan Wood.
I'll sort that out. Thanks. Thank you very much for that introduction, and thank you everybody for coming. A joke I've used before when I get an introduction like that is that I wish my mother was here, and the funny thing is my mother is here tonight. So I'm sure she's floating in her chair right now with that type of introduction. It's also nice to see that certain members of the Stop the Violence BC Coalition are here, and I've been basically tasked with introducing the coalition and talking a little bit about what we're trying to do, and I'll share with you some of the polling data. Another funny thing is that just before we started tonight, I had a conversation with the people organizing and said, maybe we should show the video. And the funny thing is the video is essentially my talk. So if you missed the first 2-minute video, I'll review some of those concepts with you. So first of all, I'm coming from a public health perspective. There's individuals in the coalition from law enforcement. I think their views will probably be reflected by the invited guests from out of town tonight, but I certainly have no conflicts of interest. And essentially what I'm going to be talking about is something that I think all of you have seen a great deal of in terms of what's happening on the streets of the city in terms of organized crime, and it's something that's been going on for a very long time. I don't know if you can see the date on that, but that's from 2007, when according to the province newspaper anyway, it wasn't one gang war, it was 4 gang wars. And reflecting on the debate in California, which many of you may have seen around the Proposition 19 campaign, which was a ballot initiative to tax and regulate marijuana, the notion behind that was, given the state of the American economy, perhaps we can raise tax revenue if we tax and regulate the very large marijuana industry that exists in California. But unfortunately, a debate emerged that became very polarized with, well, you might be able to raise tax revenue, but on the other hand, you'd have all these other harms if you regulated it, which of course I don't think is a very good starting point for the discussion, because we should be talking about the harms of the unregulated market, and then we can talk about other issues like how much tax revenue can be raised. So I'll just share some of these images with you that we pulled very easily from media clippings to include on the cover of the first report. This is obviously not an issue that's only happening in Vancouver. Vernon, Kelowna, Prince George, obviously organized crimes tentacles are being seen throughout the province, and that's manifesting in the media and elsewhere in terms of a description of this. And I have a real problem with how the media has been covering that, and I'll describe that in a moment. But certainly, all of you will be familiar with these types of images. Unfortunately, I think the scientific community, and with many respects the law enforcement community in terms of an evidence-based discussion, has been totally absent. And I see people here from the marijuana activist community who I think have been very much left twisting in the wind by the health and the scientific community, who hasn't been engaged in this discussion. Now, one group that many years ago in 2004 did insert themselves into this discussion was the Fraser Institute, who estimated that the value of the cannabis market in BC was worth somewhere between $2 and $7 billion annually. And you can see the conclusion of their report. If we treat it like any other commodity, we can tax it, regulate it, and use the resources the industry generates, rather than continue a war against consumption and production that has long since been lost. But again, certainly the medical community, the public health community, I think there's just a stigma about talking about this. And this is sort of summarized in this cartoon, which I'm not sure if you can see the text, but you have a professor standing at a podium saying, while limited, we have some emerging evidence that might point to the slight possibility that maybe the war on drugs is not optimized, though I can't say this with certainty, and more research is certainly needed. And I think that's actually a flattering cartoon of the health and the scientific and the medical community when it comes to the war on drugs. I think people just have not really been talking about the evidence. But in terms of what's happening in this country and the debate about how to deal with crime, and drug crime is part of that conversation, as you may know, in the Omnibus Crime Bill is a plan to impose mandatory minimum sentences for possession of more than 5 marijuana plants. And from a scientific perspective, that's just absolutely absurd in terms of believing that would reduce the use and availability of cannabis. And I'm not pissing and moaning as implied by this New Yorker cartoon, but I will very briefly back up what I'm saying with data. So I think Neil's going to talk about this shortly in terms of the just horrible impacts on communities of the war on drugs in the United States. But if you look just for a graphical perspective of the number of people that are now in prison in the United States because of the drug laws, it's just been an astronomical impact on the tax base and on communities, as I mentioned. This is sort of a mirror image of that graph, and this is essentially what the federal government has spent in billions of dollars in the war on drugs. It's an inflation-adjusted 600% increase. It ends in 2002 because they did some tricks with their budget reporting to hide some of the costs, essentially. So it ends there. But what you would expect from this investment is that you'd be constraining the marijuana market because a lot of energy went into marijuana control. You'd expect that the price of marijuana would go up. You'd expect that the potency or the quality of marijuana would go down. You'd expect that it would be less available to young people. And what's fascinating is that the government invested a lot of money to track these different measures. And if you look at the potency of cannabis, and I'm not asking you to infer causation here, I'm just highlighting the absolute failure to constrain this market, as you could see how the potency has tracked upwards over time despite these investments. This is U.S. government data. So this is what the data show in terms of the price. That's the blue line. And the estimated price of marijuana in the States, you can see how it's gone down fairly dramatically, and again with the potency going up. Now, one of the scientific organizations that is tracking this data, and the war on drugs has been extremely well funded, and so research in addictions has also been quite well funded, is through a group called the National Institutes on Drug Abuse, or NIDA. And even their own data, you can imagine how conservative this group would be in terms of being closely affiliated and funded by the White House. They conclude that over the last 30 years of cannabis prohibition, the drug has remained almost universally available to American 12th graders, with approximately 80 to 90% saying the drug is easy to obtain. So, there's a couple of scandals here, I think, and obviously one scandal is just the stunning ineffectiveness of these investments to constrain the cannabis market. So then what about the consequences? We could actually have a whole evening dedicated to that, but what we are entering into this conversation is to talk about violence. And really, when you see these images on TV or in the newspaper, there's always 3 things that are in these images. You have drugs, oftentimes marijuana, but certainly not always, guns, and money. And this is used to try and get the population behind further investments in a war on drugs approach, when of course it's the illegality of drugs that creates the profits that people end up fighting over. Now, things were really bad in 2009, and for whatever reason there's a Wikipedia entry about it. But this was actually sort of had an impact on me personally in 2009 because I was working at Vancouver General Hospital in the emergency room on 3 occasions when people who had been shot in this gang warfare were brought in. And it had a profound effect on me because it's very disconcerting when you're resuscitating someone in a trauma bay and the police are there and they're locking down the emergency room to ensure no one comes in to finish the job. And then I saw this poll, which you can see was from 2009. Angus Reid saw all this was happening. This was very high profile in the media. And so they did a poll to ask people, who would legalize marijuana to reduce violence. And you can see 2/3 of people said they would. And I was totally stunned by this because my focus really has been on the treatment of HIV among people who use drugs and prevention initiatives, which are very controversial and are often extremely frustrating and an uphill battle in terms of public opinion. And I saw this and I thought, okay, there's people and voices in the marijuana reform community, but it's been totally absent that there's been a concentrated effort, coordinated from the academic and scientific community and the law enforcement community to back up those voices and validate what they're saying. I also took a bit of an academic interest in this because I wanted to look and see what the research says, and not to bore you about research, but basically in medicine there's a hierarchy of evidence which at the top of sits the systematic review. You take evidence from all corners and you put it together and you come to some conclusions. So we did a systematic review to look at every English language study that had ever looked at the association between drug law enforcement and violence. And we recruited a friend of mine named Gordon Guyatt, who's a professor of medicine from McMaster University. He coined the phrase evidence-based medicine. He's made major contributions to designing how to do these types of systematic reviews. Greg Rowell is the head of the Woodward Library at UBC, so obviously librarians know about how to do systematic reviews. He did the search. Dan Werb is a PhD candidate who led the paper. And essentially, when you boil all the evidence down, there's no study that has ever shown that increasing drug law enforcement reduces drug-related violence, and there's evidence from all over the world showing that it increases it. So enter Stop the Violence BC, which really came together quite organically when people in British Columbia from law enforcement and people from public health and others all started saying, hey, why don't we start a conversation about the gang violence that's been happening? And the title of our first report is called Breaking the Silence because I think, as you'll soon see, the public is way ahead of politicians on this, and politicians are just not talking about these issues. In a nutshell, it's a coalition from experts across BC. From the scientific side, there's experts from all major BC universities, and we're trying to start a public conversation with sort of three main points. First, the failure of supply reduction in terms of limiting the availability of cannabis to young people. As was mentioned in that video, young people have easier access to cannabis than alcohol and tobacco. And I compare those two because of the fact that those are legally regulated things that we're trying to control, and they're less available to young people than all this money that's gone into the war on drugs. The harms of the existing model, of which money going to violent gangs is only one thing, and then the potential value of a regulated market. We've generated some traction to date, and this is the editorial from the Vancouver Sun earlier this week. And I'll talk a little bit now about some of this Angus Reid data. So essentially, Angus Reid had been doing some of this work, and we commissioned them to do this poll, and the results, I think, are quite stunning. So first of all, 90% of British Columbians see the link between cannabis prohibition and what's happening on the streets. I think it's really important to make clear that nobody involved in the coalition, and there's a lot of evidence to support this, is saying that all people involved in the cannabis industry are violent. I think nothing could be farther from the truth, and actually there's a Justice Department study that shows that most people involved in grow ops in BC are not affiliated with organized crime, and they're not violent. They're people who are trying to pay their mortgages just like everybody else. But when that bud that comes from all those grow ops comes down to the big cities, and 100-pound deals are going across the borders and other things, organized crime clearly has their tentacles deeply involved in that, because you see it in the court cases for when they're getting caught for various things. This is, I think, one of the most stunning statistics, is that only 12% of British Columbians think that existing marijuana laws should be kept unchanged. I mean, it really, once you're down to that sort of 10% range, you're dealing with the extreme views. Now, you might be sitting there saying, well, maybe people want to see drug laws toughened, right? That's what Harper's doing. He claims that the Canadian public elected him to do just that. But if you actually look at what people think in terms of a criminal record for possession of a marijuana cigarette, you see it's almost exactly the same. About 80% of people think that should not be how the laws are now. but they are. There's some discretion in enforcement, but certainly anyone could walk out here, and if you had marijuana in your pocket and you ended up with the wrong police officer, you could be charged in front of a judge. This is interesting because if you ask the question about mandatory minimum sentences and specifically ask about possession of 6 or more marijuana plants, you see that actually a solid majority of people oppose that, which I think is actually quite striking, at 56% opposing that, almost 40% supporting it. And I'm amazed it's not higher than 40% because the RCMP and other groups that have been on a campaign about the harms of grow-ops, the property damage, the home invasions, the hydro theft, and all the problems and frustration that British Columbians have with that, the key is to talk to that 40% of people and make clear to them that that activity is happening because of prohibition. It's not, you can't apply more law enforcement resources to make that type of thing go away. Chasing and arresting marijuana producers and sellers is ineffective. We'd be better off taxing and regulating the adult use of marijuana. About 70% of people support that, according to Angus Reid. And that's before we've even had a conversation about what regulation would look like. And it's only 24% who oppose. And I think even a substantial proportion of those don't even know what that might actually look like. I alluded to a bit of dissatisfaction with the media, and this is just one example. All the stories about the gang violence are essentially totally missing the point. And there's other people, and I don't want to single out anyone because this could be anyone. But I think we really need to engage with these people because there's a lot of fear-mongering about what a regulated market might look like. And I think we really need to engage with people who are scaremongering and saying, oh, well, the status quo is better than what it might look like. And there's not a lot of time to talk about this, but essentially what this figure is showing is that you can see as the social problems go up, the illegal market clearly is contributing to social problems, okay? Organized crime, we could go on and on about the problems of prohibition. On the other side, I think we should acknowledge that if we went with a sort of capitalistic version where we tried to increase the number of people that were using drugs through advertisement and promotion and all the things that we know are harmful with alcohol, and tobacco, that there would be harms there as well. But there is a whole scientific literature about how psychoactive substances can be regulated to reduce rates of harm while at the same time maximizing the potential to generate tax revenue. And I think the sort of 24% of people who are opposed to this, we can engage with a lot of those people when we start talking about what a regulated market might actually look like. So how you can get involved, for people that haven't seen the website, I encourage you to go there. We would welcome any and all of you to join the coalition. For those that are able, I should mention that everybody that's in the coalition is essentially volunteering their time, and it's become unrealistically costly to continue this conversation given the cost of generating reports and media and that kind of thing. So if you know someone who's in the mining industry or something like that that could make a donation, that would be very welcome. And certainly spreading the word. And I know a lot of you have been doing that, and others that want to get engaged in the conversation, that would certainly be welcome. Just a very quick acknowledgement to the people that have helped organize tonight, and thanks to Am for mentioning some people by name. But thank you for coming, and I'll turn it over to the next speaker.
Your mother's even more proud now, I'm sure. Thank you very much for that, Evan. Damon Barrett has come a long way to be with us tonight. He is the co-founder and project director at the International Center on Human Rights and Drug Policy. It's dedicated to developing and promoting innovative and high-quality legal and human rights scholarship on issues related to drug laws, policy, and enforcement. Its academic home is at the Irish Centre for Human Rights at National University of Ireland, Galway. Just to tell you a bit about Damon, he is a senior human rights analyst at Harm Reduction International. It's a London-based NGO